Okay, today I'm going to check your musculoskeletal system and your strength. I'm going to start off by checking your temporal mandibular joint. So right here, right in front of your tracheus. So I'm going to have you, I'm going to have you move your mouth from side to side. Good. I'm going to have you protrude it out and then back in. Good. So you have some popping and popping, which is normal. So next I'm going to check your cervical area. Do you have any tenderness here?
No.
Okay. So next I'm going to have you flex your head down. Then I'm going to have you flex your head back. Good. Now I'm going to have you go from your ear to your shoulder, from side to side. Good. Any tenderness when you do any of that?
No. Tightness, but no tenderness.
Okay. I'm going to have you Okay, so first I'm going to have you, this is what I'm going to do. I'm going to put my hand up against your forehead. I'm going to have you push forward. Good. And have you push back. Good. Good. So you have full range of motion and +5 strength. Now I'm going to have you stand so I can check your spine. I'm going to assess it from actually I'm going to have you go this way. I'm going to assess it from the side. Your cervical area is concave. Your thoracic area is convex. And your lumbar is concave, is there any tenderness when I push down on any of this? No. Okay. Now I'm going to stand behind you and feel your spine over your cerebral column. Any tenderness?
No.
Okay. Now I'm going to have you bend forward so I can check your spine alignment. I'm going to have you touch your toes if you can, but good. Okay, you can come back up. So your spine is nice and straight. So now your posture is upright and your shoulders are equal. Your hips are equal. So that's good. I'm going to have you lean backwards. So that's hyperextension. Straight up, I'm going to have you stand straight up, which is regular extension. And then I'm going to have you put your hands by your side and then move down. That's lateral bending. Good. Then I'm going to have you rotate your arms. So like this. Good. Perfect. You have great full range of motion. Do you have any tenderness at all when you're doing any of those movements? No. Okay. Good. Okay. So now I'm going to feel your shoulders for any tenderness. Do you have any tenderness?
No.
Okay. Good. I'm going to have you lift one arm all the way up. So that's flexion, then all the way down. That's extension. Good. I'm going to have you move it back. Like back, nope. So I'm going to have you go back here. Yep, good. That's hyperextension. Next, I'm going to have you, with your arm out, I'm going to have you go like this. That's abduction. Down, adduction. Good. Then I'm going to have you put your arm behind your head. Like this. That's external rotation. Good. Then I'm going to have you, so I'm going to put my hands up on your shoulders. I'm going to have you push up. Good. You have +5 strength, so that's good. And you have full range of motion of your shoulders. Now I'm going to have you sit back down over there, and I'm going to check your elbows. Do you have any tenderness when I touch this? I don't see any redness, which is good. So I'm going to have you bend your elbow. Good, that's flexion. Then extend it back out. That's extension. Good. Now put your arms out and your palms up. Like this. Like this. That's supination. Now arms out with palms down. That's pronation. Good. Next I'm going to have you put your arm out and I'll push on it. Okay? Push up. Good. Push down. Good. You have +5 strength. That's good. And full range of motion. So, good. So that's that. now I'm going to check your wrist. Do you feel any tenderness? There's no redness, which is good. Do you feel any tenderness when I'm palpating it?
No.
Okay. So I'm going to have you put your hand down. That's called, put your hand like this. That's called flexion, and then up. That's extension. That's hyperextension. Now I'm going to have you move your hand towards your thumb. So, like, put your hand out straight, and I'm going to have you open your fingers a little. I'm going to have you turn your wrist this way. That's radial deviation, and then the opposite direction. That's ulnar deviation. So that's checking the strength of your wrist. So now I'm going to have you flex down with your hand like this, and I'm going to push down and have you push up. Good. That's +5, full range of motion. Next, I'm going to check your fingers. Kind of check each joint. I don't see any redness, any swelling, any deformities, which is good. I'm going to have you make a fist. That's flexion. And then I'm going to have you open it. That's extension. I'm going to have you open your fingers like that. That's like perfect. That's abduction. Then close your fingers. That's adduction. Take your thumb and meet it with your middle finger. That's flexion of your thumb. You have positive range of motion, which is good. Then I'm going to have you open your hand. Okay? I'm going to go like this. I'm going to have you squeeze my 2 fingers as hard as you can. Good. +5 strength. So you have full range of motion of your fingers and +5 strength. So that's for your neuro. Now I'm going to move on to your neuro system. Can you please tell me your name, date, and where you are right now?
Carol Flanagan, December 9th, 2015.
Yep.
I'm in my home, Baldwin,
Okay,
Mass.
perfect. I'm just checking to see if you're alert and oriented. We'll move on to your cranial nerves. The first cranial nerve is the olfactory. So, hold on one second. So I made a little mistake. Before I start the neuro assessment, I have to just check your toes for your muscle strength also. So I'm going to palpate your toes. Do you have any tenderness?
Yes.
A little bit.
I have a bunion.
You have bunion, okay. So I'm just going to, I don't see any really swelling or deformities. I'm going to have you lift your toes up, so like that, and bend them back if you can. So that is called flexion, well, dorsiflexion. Then I'm going to have you put your foot down. That's called plantar flexion. I'm going to have you turn your feet in, so like that. That's, aversion. Then I have you turn the opposite way. That's inversion. I'm going to have you put my hand, I'm going to put my hand on your foot, and you're going to push against it. Good. Perfect. So that's considered, that's fine. You can put that down. That is considered +5 strength, full range of motion of your toes. Now I'm going to do 2 tests to check for carpal tunnel. So the first one is the Fallon test. I'm going to have you put your arms together like this for 60 seconds. Do you feel any numbness or tingling when you're doing this?
No.
Okay, so that's a negative test, which is good, so you can put that down, that's fine. The second test is the Tonelli's test. I'm going to take your hand with palm facing upright, like that, and I'm going to tap on your medial nerve. Do you feel any tenderness when I do this?
No.
Okay, good. Perfect. So those are both negative, which is also a good sign. So now we can move on to the neuro system. Okay, which I already asked you previously what your name, your date of birth is. That's all just to check to see if you're alert and oriented. Mm-hmm. So we'll move into the first cranial nerve, which is the olfactory nerve. So I'm going to get an object, and I'm going to have you close your eyes. Mm-hmm. And I'm going to put this up to you. I'm going to have you block out this nostril. And then I'm going to have you smell this, and you try and tell me what it is. Okay. Let's try a little bit. Hold on 1 second. Sorry about this. Okay. So tell me what this is. What's that?
Something like vanilla or eggnog?
Yep, vanilla. Perfect. Yep, that's vanilla. Okay. So that's good. So we know that your olfactory nerve is working and that your nostril has good patency. So next, that was cranial nerve 1. Cranial nerve 2 is the optic. So in order to do the optic nerve, which is cranial nerve 2, I would use the Snellen chart. I would check your right, left, and both eyes. That would also check your visual acuity for distance. I would also check your near vision. Next we would do the confrontation test, but we also check this during week 3. So I'm not going to check any of this because I know that your vision is 20/20 and your peripheral vision is intact. So the next cranial nerve we would check is 3, 4, and 6, assessing the 6 fields of gaze, which were checked previously also in week 3, along with the shape, equality, constriction, and accommodation for cranial nerve 3. Cranial nerve 5 is your trigeminal nerve. There's 2 rings. So strength is 1. I'm going to go to your temple area and ask you to clench your teeth. Good. Okay, perfect. Then I'm going to go to your, which is +5, so that's good. Next I'm going to go to your masseter area, and I'm going to have you clench your teeth also. Good. That's also +5. So I'm going to use